Hello! Good day, everyone. Welcome for today's activity. In this recreation, I will be served as your moderator. My name is Niño Flores, and today we will be having a panel discussion. As your moderator, it comes with great honor and privilege to deliver this online assemblage. And on behalf of our audiences, or the ones that are watching, I will do my best to relinquish the program prosperously. Today, we have gathered here with our four panelists that are willing to share with their different insights about the topic, addressing the response of DOH in COVID-19 pandemic, health workers, working conditions in the Philippines. Starting our first panelist, Mr. Gab Sairel Llamido, followed by Miss April Jenaila Llanes, Miss Jenny Nicole Belando, and lastly, Mr. Joveth Anor. Each panelist are given a maximum of 1 minute to share his or her ideas on the given topic. The other panelists are expected to be silent and should not interrupt while the panelist is giving her or his insights. At the end of the discussion, the panelists are free to ask questions with their fellow panelists if they still something have in mind or if they need something to correct. To formally introduce to you all our first panelist, the first to give his views, Mr. Gab Sairel Llamido.
Thank you, Mr. Khline, for introducing me. We already know, in this pandemic, one of the busiest workers in the Philippines is the medical workers. Many of them risking their lives just to save others. They are the modern heroes of the present day, but the DOH response to them is quite slow. Many of our medical frontliners are underpaid, exhausted, and affected by the virus. The government should make a move to motivate once more our medical frontliners. Increasing their basic salaries would be a great step to motivate them to work hard. Acknowledge them and many more. The government need to emphasize a concrete plan because the health workers are dying for nothing. They are saving many lives, and our government and some Filipinos don't appreciate their work. The government should make a bill that will protect the dignity of our health workers because they are tired physically and mentally. The government should implement the law that will protect them, not just acting like a blind and do nothing.
Thank you, Mr. Gab, for sharing your noteworthy intuition. Mr. Gab has shared what he observed based on how the DOH addresses our health workers and the Filipino society as well. Therefore, he is looking forward of implementing a law that will protect these underappreciated heroes. On the other hand, let's hear what our second panelist think of the same situation. Ms. April, the floor is yours.
So, I just want to thank our moderator, Mr. Khline Flores. So, today, if we talk about health workers' conditions, I just want to open up the topic which is all about low pay, high risk. It is a reality problem for our heroic nurses here in the Philippines. It is so very difficult for us to realize that our nurses doing their jobs with all their hearts, but their salary aren't enough for them to provide their needs and expenses. But how much the total salary of the Filipino nurses here in the Philippines? According to DOLE, or the Department of Labor and Employment, an entry-level registered nurse receives the amount of 8,000 to 13,500 per month, while registered nurses hired by the hospitals is getting amount of only 9,757 a month. Oh my god, can you imagine that? And in government, it only getting 13,500 per month. So imagine that, our nurses putting and giving all their hard works, time, and even their own life for us and to their passion, but no one in our empowered people can do something to make their salary high based on what they really deserve. And to be honest, they really don't deserve to be treated and pay off like that. Where's the justice?
Thank you, Miss April. Miss April talked about how underpaid our health workers with a higher risk of jeopardy. So far, we learned what kind of situations that our health workers have faced in the field of healthcare. Maybe we can learn more for our next panelist, Miss Jenny Belando. Miss Jenny Belando, you may state your views.
Thank you, Moderator Khline. If we're talking about the working situation of our healthcare workers, I'd like to bring up the topic of overworked, underpaid health workers are walking away as Delta Ravage PH. Many of our frontliners are risking their lives to save lives, but they did not deserve the treatment they receive with their government. Their salary has already been delayed for over 2 months. They should fund and provide support for our health workers. Some of our frustrated frontliners recently took the street to demand the release of their long overdue COVID-19 benefits. If we are heroes for you, why has it been a year now yet they are still in the street calling and shouting for the immediate release of our hard-earned COVID-19 benefits? Said Edwin Pacheco, President of the National Kidney and Transplant Institute, Employee Association Alliance of Health Workers. Being called a hero when give a quantity to sustain the daily needs of our frontliners, equal pay is needed so they could put food in their plates and live.
Thank you, Miss Jenny, for sharing your enlightening cultivation. Miss Jenny has shared about how overworked our health workers are and how the allied health won't give enough amount to sustain the frontliners' daily needs. Maybe our next panelist will give an enlightening memorandum too. May I call on Mr. Joveth Anor? You may state your insight.
When it comes to the working condition of our healthcare professional, I'd like to bring up the topic of misused COVID-19 funds alleged as Filipino health worker practice. According to official data, over a third of hospitals have reached critical levels, more than 85% occupancy, prompting the Philippine Nurses Association to stage a virtual protest to demand improved working conditions and additional personnel. Based on Dr. Tony Liajon, a former consultant in Duterte COVID-19 response, worried that Philippines might be soon the epicenter of epidemic in Southeast Asia. In an interview with Manila-based TV station, he described the Philippines as being the midst of a perfect storm, inciting increase the number of infection and low vaccination rate and weak contact tracing mechanism, all of which is exacerbated by a congressional inquiry into suspected misuse of COVID-19 funds. If we don't have control over the healthcare system, it will soon collapse.
Thank you, Mr. Joveth, for sharing your views regarding to this circumstance. Now, let's move on to our question and answer portion. The panelists may now ask questions they have in mind for them to be enlightened. Panelists, you may now state your questions.
So here's the question I'd like to ask you, Miss Jenny Nicole. What exactly treatment should the health workers receive from our government?
Thank you for that question, Sai. For me, I think the government should increase the salary of our frontliners. They would receive the right amount for their COVID-19 benefits. The government should provide their lodging area. Therefore, they wouldn't bring home the virus to their family.
Thank you, Miss Jenny Nicole, for answering my question.
Here is the question I'd like to ask to Miss April. Who among the empowered people can do to make the salary of every health workers increase? And how can he make that possible in this time of pandemic?
So, thank you so much for that interesting question, Miss Jenny Nicole. Anyone in our empowered people can do something to make the salary of the Filipino workers increase, because if they really cared about them, they have the initiative to find ways to make it happen. Because if they have many ways to steal money from the government, then for this simple concern, it should be possible too.
I have a question for Miss April. According to Dr. Tony, what will happen to our healthcare system if the COVID-19 funds will still misuse?
So, thank you for your question, Mr. Joveth. So, for me, if we do not control the misuse of COVID-19 funds, it will cause up collapsing healthcare systems.
Again, a question for Miss April. What nurses association protesting for?
So, they're demanding for improving working conditions and additional personnel.
Wow, well, that discussion really gives me a new learning regarding to our topic for today. I hope we can discuss more to explore and to open a new perspective, maybe apply it in our daily basis. But I'm sad to say that we don't have enough time. Well, that is all for today's discussion. and I hope that our viewers have learned something mind-blogging and noteworthy. I would like to thank our panelists that have joined us here for today. Again, this is Niño Khline B. Flores, wishing you a good day ahead.